Hi everyone, and welcome to A&P with Dr. O. We are going to be using an articulated skeleton, or at least part of an articulated skeleton for this video here. And we're going to use it to talk about the different types of ribs. And then in a moment, we're also going to look at just one rib and take a look at the parts of a single rib as well. Let's start with our types of ribs. And of course, we always want to get our bearings. Here we have the left clavicle. And so on the other side, we would have our right clavicle. They are going to articulate with both the sternum and then the scapulas back here. But if we focus in on the sternum, we can see our costal cartilages here as well. And then we can go ahead and see our ribs. Now, the reason why we want to pay particular attention to the sternum and the cartilages here is because it's going to play a role in our discussion of the types of ribs, whether the rib is true, false, or floating. True ribs are the first 7 and they join the sternum directly. So if we start at the top, 1, 2, 3, 4, 5, 6, 7, those are going to be our true ribs. Following those are the false ribs, ribs 8 through 12, where cartilage does not reach the sternum directly. Then we've got 8, 9, 10, and then down here we've got 11, and then back here we can see number 12. Again, those are false. The cartilage doesn't reach the sternum directly. Ribs 11 and 12 can be classified as false and floating because you'll notice that there is no attachment to the sternum at all. There's no costal cartilage attached to these ribs. They don't attach directly to the sternum. They appear as if they're just floating there, and that's how they get their name. Now let's take a look at just a single rib and a few structures that we are going to identify on that particular bone. If we're looking at just one of the ribs and we're looking at an inferior view, I think it makes it a little easier to see some of these structures we're going to talk about. We can note 3 things: the head, the tubercle, and the neck. Anytime we use the term head, it's an expanded articular end. And then after the head is generally where we find the neck. Tubercles are small, rounded projections. We can see this small rounded projection here. This is going to be our tubercle. Here we have our head. This is going to be our articulating end. And in between the two, we are going to have the neck. Our head, our neck, and then our tubercle. And I know sometimes in these videos it's hard to see these bumps and projections. I encourage you to look and feel these on the bones, the actual bone models, as much as possible. Pictures and videos just don't do them justice, and you'll really be able to get a better feel when looking at these on the actual model. But that would be the tubercle right there, the neck, and then the head.